Using a poorly designed hyperbaric protocol is dangerous. It can harm a person. It's absolutely critical, it's essential to have a safe and effective hyperbaric protocol in place for anybody who is going to use hyperbaric therapy, whether it's a clinic situation, a wellness space, or somebody has a hyperbaric chamber at home. Hyperbaric protocols consist of 4 variables, and in this video I will show you how to put together hyperbaric protocol using a hyperbaric protocol constructor. I normally teach this information in my offline hyperbaric course that I teach in Madrid twice a year, and at the end of this video I will give you a real-life example of a clinic that took a course back in June, and then they used the protocol constructor to create a hyperbaric protocol for their client with chronic fatigue syndrome, and will follow step by step how they've decided on each of the variables in the protocol. First, let's look at 4 variables. We have pressure. Pressure is important. We can use mild pressure or we can use high pressure. We have oxygen concentration in the breathing mixture that a person breathes inside the chamber. Person can get air, just normal room air that contains 21% oxygen. Or we can connect an oxygen concentrator to the chamber, and that oxygen concentrator would normally deliver around 70% oxygen through the mask or nasal cannula. Or we can use a hood, which ensures almost 100% oxygen delivery. Some chambers can be pressurized with oxygen, so of course in that situation it's 100% oxygen that this person is breathing inside a hyperbaric chamber that is being pressurized with 100% oxygen. Our third variable is the length of a session, and it varies from 60 minutes to 90 minutes, 120 minutes, and in some rare situations we can go up to 3 hours inside a hyperbaric chamber. And our fourth variable is the number of sessions in the protocol and the frequency of these sessions. Normally, we never put together a protocol with a final number of sessions. It's very difficult to say right off the bat that this person will need 40 sessions or 60 sessions or 90 sessions. We usually determine a set amount of sessions. I like to go with 20 sessions, and then we reassess to look at the progress to see if we need to make any adjustments. And the frequency. Frequency varies. Some people might choose to come to the clinic once a week, and although I don't recommend, and I think that this frequency is quite low, some people still choose to do it and they get some fractional benefits from their hyperbaric treatments. Or frequency can go to as high as 2 sessions a day. So it goes from 1 session a week to 2 sessions a day. These 4 variables are interrelated, which means when we choose to change one variable, most likely other variables will need to change or will be affected by the change in that variable. How do we determine which pressure to use, what oxygen concentration? How do we determine the length of the session, number of treatments, and frequency? It largely depends on the health situation of a person. That's why I always recommend to take a consultation with a hyperbaric practitioner who will make a thorough assessment of that person's health situation to determine what kind of a hyperbaric protocol will better suit the needs of that particular person. Hyperbaric protocols are individualized. There are no cookie cutter approach, and I think an approach when we use the same protocol for everybody who comes into our clinic is wrong, because we all experience stress, health conditions absolutely differently. We also have different health goals. That's another thing that we need to look at. Somebody who wants to run a marathon is very different from somebody who is recovering from traumatic brain injury or who has chronic fatigue syndrome. So their health goals will be different. So when we made a thorough assessment of the health situation and we determined the health goals of the person, we can start putting together the 4 variables into protocol. And to illustrate this, I'd like to give you a real life example of a clinic that took my offline hyperbaric course in June, learned how to put together an effective and safe protocol, and did it for their chronic fatigue client. So they had a client, a 35-year-old woman who came into the clinic who had chronic fatigue diagnosis. She had very low energy. She had difficulty leaving her house unassisted. Largely, she would stay in bed and she couldn't do much around her house. And of course, her health goals were to increase some energy, to gain independence, and to improve her health. So that clinic took the client, they did the assessment, they determined her health goals with her, and then they started to put together a hyperbaric protocol. First, they looked at the pressure, and they knew from the information that they learned at the course that with chronic fatigue syndrome, these people normally have already quite high levels of oxidative stress. So not to overwhelm her system, not to give her additional oxidative stress that her system might not be able to counteract with antioxidant defenses, they started with lower pressure. They started at 1.3 ATA. For oxygen concentration, initially they chose room air for the same reason. They didn't want to overwhelm her system initially with too much oxygen. And they went with room air. For the length of the session, they chose 60 minutes because, again, they didn't want to overwhelm the system with too much oxidative stress. 60 minutes is usually enough to stimulate parasympathetic response in which a person normally heals. And their number of sessions were 10 sessions and then reassess based on the symptoms that the client came with. And the frequency was determined to be 3 times a week. They chose a frequency of 3 times a week to give a client 1 day in between for a break to make sure that she can recuperate from being subjected to oxidative stress from hyperbaric oxygen therapy and to make sure that her body can adjust. Doing less than 3 times a week is not necessarily therapeutic and will not bring the effects that the person is looking for. However, 3 times a week was a good frequency. A person did 10 sessions and then they reassessed. I have a video on how to do reassessments. Basically, we use special questionnaires that people fill out before they start hyperbaric therapy. We usually ask them several questions every time they come in. So we'd like to see how their main symptoms change. And in this particular client, they looked at her energy level, they looked at her sleep, mood, and independence. After 10 sessions, they saw a slight improvement in all of those parameters. So they decided to go for another 20 sessions and introduce oxygen for 20 minutes every session using an oxygen concentrator. And as I mentioned, it delivers roughly around 70% oxygen if you use mask or nasal cannula. Person kept improving. So there was a third part of that protocol, another 20 sessions, again with oxygen. The client kept improving. She felt really happy. And at the end, she decided to do maintenance sessions once or twice a week for some time to make sure that she keeps up with her energy level. You see how they use this protocol constructor. So they looked at 4 variables and they went with the client's situation. Instead of having one protocol for chronic fatigue that would work for every chronic fatigue patient, which I think innately is wrong because every client presents with different symptoms, everybody has different vitality, different tolerance to increased oxygen. They created a personalized protocol that worked really well for that client. If you'd like to learn how to put together protocols, how hyperbaric therapy works, what are the mechanisms of action, how different health conditions respond to different hyperbaric pressures and different concentrations of oxygen, I encourage you to take a hyperbaric certification course that I normally teach in Madrid. It's an in-person course, so you get to come in for 4 days and we talk everything hyperbaric. You get to ask your questions and you get to meet wonderful people who come to take this course and be part of this community. But most importantly, at the end of this course, you gain a certification and you're able to deliver hyperbaric therapy in an effective and safe manner. If you have questions, leave them in the comment section below. Otherwise, please give this video a like, subscribe, and I'll see you next week.